The third edition of Ritshidze State of Health report reveals that only 3% of HIV patients in the Free State received an ARV refill of 3 months or more. The report compares data over the last 3 years of community-led monitoring in that province. This data, including stories from HIV patients and other public healthcare users, was presented at 2 community meetings in the Thabo, Mufutsanyana and Lejwe municipalities this week. Now, for more on this conversation, we're joined by Ndivhuwo Rambau, a project coordinator at Ritshidze. Ndivhuwo, good evening and a very warm welcome to you. Now, take us through the purpose of this report and maybe just give us a brief summary in terms of the sample that was used.
Okay, so thank you, and thank you so much for having us this evening. So as you mentioned, this is the third edition of the State of Health report for the Free State, and the first one was published in September 2021, the second one in September 2022, and the data are collected in our monitoring cycle, which is between April and June 2023. And like the earlier editions, the third edition also identifies challenges that discourage people from going to the clinic for HIV, TB, and other health services. And in Free State, we monitored over 21 facilities in the province, and we also collected additional data related to the availability of HIV prevention tools from a SNAP survey of 84 additional facilities. And we spoke to over 1,000 key populations in the community, as well as over 1,000 people who are healthcare users in the province as well.
So you held district community meetings over the past couple of days, in fact, on Wednesday and on Thursday. What were some of the findings that you got from those dialogues?
So what we are finding in terms of ARV refill length is that it is true when it comes to ARV refill length, compared to Mpumalanga, where 64% of people living with HIV reported receiving a 3 to 6 month ARV refill. That is not really the case in the Free State, and we find that not having to go to the facility constantly just to get a refill every month is something that is quite stressful for people who are living with HIV. You find that people living with HIV have to wait the whole day and find it very frustrating, yet there's a simple solution for people who are collecting ARVs to just get a longer supply of medication if they are stable on their treatment.
This surely does speak to the level of service delivery in those clinics and hospitals in the province of the Free State. If people are waiting for 6 hours in queues and are only getting treatment, only 3% of them are getting treatment for over 3 months. Are there any responses within those dialogues from the Department of Health within the province to say as to why people are being treated this way?
So we were joined by the Provincial Department of Health representatives, as well as the district managers for Lejwe as well as Thabo Mufutsanyana. And the officials were very firm to say that, we really need to clamp down on issues of staff attitude, because that is also another thing that really hinders people from wanting to use healthcare facilities. Getting to a facility and finding a healthcare practitioner is quite moody or upset, or there's a clerk that doesn't speak properly to people. It's really off-putting for not only people living with HIV, but also general patients as well. And they have committed to, one, look into each person who is giving a testimony at the accountability meeting to resolve those issues, and also to have one-on-one sessions with some of the facilities that were mentioned that had some problematic issues coming out of them.
This is the third report. In terms of your comparison to the other 2 years, how do you see, especially the province of the Free State, sort of faring when you compare the numbers over the 3 years?
So unfortunately, when we compare the Free State with other provinces that we monitor in, and this is just at a Ritshidze data level, the Free State didn't do as well. as much as waiting hours went down from 6 hours from last year, they went down to 5 hours. So that is quite a long time for people to be waiting at the facility. We also found that the Free State, within the Ritshidze data, had quite the dirtiest facilities compared to other clinics in other provinces that we actually monitor. So it is quite a long way in improving the services. And also when we touch on issues of key populations, there are no drop-in centers for key populations. So it means that, for example, transgender people have to struggle to get certain services because they are not available within the province, and they find themselves having to travel as far as Johannesburg, for example, to get things like hormone therapy and things like that.
And in the other provinces, I mean, as you say, the Free State isn't faring so well, but which provinces can the Free State then look to and sort of try and copy those best practices in order for them to improve?
If we look at the issue of the ARV refill length, I think Mpumalanga is amongst the Ritshidze data that is the province to look to and to learn from the lessons that they have maybe input to ensure that people living with HIV who are stable on treatment get the longer refill. And also in just trying to understand how some of those facilities also have very good filing systems, because in Mpumalanga we found that the filing systems, yes, they were bad, but there were facilities that were doing quite well when it comes to their filing systems and managing the filing systems. So there's a lot that other facilities can perhaps learn when it comes to certain aspects like that, because patients do arrive to the facility only to find that, look, your file is missing, and people are not told that the file is missing on time, and then you end up having to wait for the whole day, yet your file is actually lost.
What do you find are the long-term effects, especially for those who are living with HIV and AIDS that would go on for months without their ARVs? What are the long-term effects that they are likely to face, especially in provinces like the Free State?
So in most instances where the staff attitude is really off-putting, people living with HIV end up disengaging from care completely. And where people living with HIV don't disengage from care, they opt to use facilities that are further away from them. So in some instances, you'll find someone leaving Mama Habani to go to Bloemfontein Clinic, which costs about 280 rand. We've got a high level of unemployment, but people will try push with the small social grant monies that they have, that they can go to another facility where they will be treated better, so that they can, at the end of the day, also save their lives. Because people on the ground are saying, look, we want to save our lives, we want to take treatment, but if I'm going to be mistreated at the facility where I should be treated well and should be understood, it's very difficult at the same time.
I can imagine that with the previous reports, there must have been recommendations. With those recommendations, are you finding that there are some kind of implementations that are being made by these facilities in order for them to be more efficient?
So in terms of recommendations, there were like a number of recommendations that were also directed to the Provincial Department of Health. We also have recommendations that are directed to the district support partners. In this instance, it's the Reproductive Health Institute and Right to Care as well. And at a facility level, where facility managers are able to implement some of these things, they really do. But some issues really need to be either escalated to the district or escalated to the province. So, for example, last year the Free State Health Department committed to ensure that condoms and lubricants were available in all sites, and that PrEP would be offered to all key populations. And we found, there has been an improvement. When compared to last year, where only 23% of facilities had lubricants. Now we found that lubricant is available freely in about 45% of the 104 sites that we monitored. So that is a slight improvement, and we really want to commend the department on fulfilling some of that, but we really do want to see more.
Certainly more improvement needs to be done. And what are the recommendations that you've put out now after the findings that you have?
So in terms of recommendations, the first one that we really want to hammer on is getting people living with HIV to be on a longer ART refill. So if you can get people living with HIV facilities in the Free State in Thabo Mofokeng and Ndivhuwo on a 3 to 6 month ARV refill. We believe that it will really help in decongesting the facilities and also ensuring that people really do stay on treatment. In terms of staffing and waiting times, we have put forth recommendations that, all of those empty vacancies should be filled and that an audit should be done for all of the vacancies that we are seeing that are not being filled, because we are finding that healthcare professionals are also quite overwhelmed and also tired because you have to see so many people and you are quite overworked and overburdened as well.
All right, Ndivhuwo, thank you so much for your time this evening. That was Ritshidze Project Coordinator Ndivhuwo Rambau speaking to us there about the third Ritshidze report that has now recently been released.